We're going to run through the 3 movement tools. Now these are tools that we utilize throughout the day to move more efficiently and can also help to reduce the aggravation that you place on your spine and also trigger off some back pain. So now the key with these guys is that they're not an exercise. We want you to integrate them into your daily movements so that they become a habit and you move more efficiently. All right, so the first one we're going to start off with is a hip hinge. So nice and simple. I always like to go with your hips side on. And so what we're doing is hands on the thighs here, and we're going to hinge back down, hands going down towards our knees, and back staying nice and neutral. And then from there, we're coming back up through our hips, right? So that's a hip hinge. So down there, coming back through, and then we're pulling my hips up and back. So we're trying to accentuate that movement coming from your hips, not so much from the spine. So we don't want to round over, we don't want to overarch and extend. So again, feel like your hips are pushing back and down. As your hands slide down, we're in a nice neutral position, and then coming back up from there. Now, if you do struggle with this one, we like to tell patients to go down onto their knees, and then you can really emphasize that hip hinge coming from the hips. So, getting down onto our knees here, and from this position, it forces you to really drive back from your hips back and down. So from here, hinging, and as you can see, there's also knee flexion, but there's a lot of hip hinging going on. And then I'm pulling myself back through, right? So it's hinging back and down, and then pulling myself back through. So as we were saying with that hip hinge, it's utilizing it when you need, right? So not an exercise, but you want to build in that movement habit. So for example, getting off and on a seat is a great example where we're going to use that hip hinge. So you can, if you want to, put your hands on your thighs and do the same thing, but obviously you don't need to, but just think about that hip hinge. So my hips are going back and down, maintaining a neutral spine. So I'm hinging down, and then to get back up, same thing, I'm pulling through from my hips. So as you can see, there's very little need for me to round or extend my spine, and that's going to help to save the spine, stop picking the scab, allow things to desensitize. Now, another great trick or tip when we're doing it seated from side on is that if you are in a chair and you're really far backwards, it's very hard for me to stand up from this position without flexing and rounding through my back because my center of gravity or center of mass is behind my base of support. So a nice little trick that we like to say, shift forward, come to the edge of the seat, feet nice and wide, nice wide base support, and then from there I can hinge and pull my hips through and I get up efficiently. So using that hip hinge when you require. Okay, the second tool that we use is what we call the split lunge. So now the hip hinge was done before, get a little bit lower down, but if you need to get really low down, say for example to the floor, this is where we use the split lunge. So again, we're following those same principles of moving from our hip and saving our spine or sparing our spine. So split lunge, as the name suggests, one leg forward, doesn't matter which one, keeping these moving, and then from here, I bring that leg back. Now make sure that you get from this position, we don't cheat. So a lot of patients will come through from here, but in this position, you've got to go around your hip and your knee, and that's where the back has to make up for that. So bring this one back, and we call this tall kneeling. So make sure you get to this tall kneeling position, and then from there, we can hinge back again, hands come down, and I walk out. Now I can grab what I need off the floor, or I'm down here if I need to do exercises, and then to come back up, we do the reverse. So hands walk back, as our hips hinge down, and then from there, we're doing a hip hinge, pulling those hips through, one leg comes back up, and we're pushing back up, okay? So I'll go through it again one more time. So make sure we maintain a neutral spine, moving from those hips. So one leg, hinging, make sure we clear this one out the way, hips hinge back and down, hands go down, walking my hand out, and on a nice neutral position, okay? Then to come back up, walk the hands back, then from this position here, pulling my hips through, leg comes back up. I can put here for pressure if you need to, and then back up. So that's the split lunge. All right, the final one is what we call torso control. Now with this one, it's thinking about when you have to turn or rotate, that we turn or rotate from our other joints, not our spine. So a lot of the time we'll say ribs and pelvis, lock them together, okay? So when we're turning from other joints, we're not turning from the spine. So a great way to get that feeling is doing the wall plank rotations. So we're coming up side on to the wall here. If you come a little bit from the side. So what we want to do first is to get that feeling, just get in a nice neutral position from here. And what I'm going to do is turn and rotate, keeping my arm in contact with this wall, but I'm going to turn and rotate to face you. So what I'm going to do is up on the toes, and I'm going to turn and rotate, right? So you see how my hips and shoulders are moving at the same time, rotating there. We don't want to lock our feet and hips there, and I'm twisting from my spine. So again, it's moving together, and then back in. And if I need to, I can go the other side as well, moving together and back in, okay? Now, That's to get that feeling of that. You don't necessarily need to rotate on your toes. What you can do instead is use the drop step. So in American football, they talk about this being the drop step. So if you're an offensive lineman on the front line, you've got your quarterback behind you there, another player coming to attack your quarterback, what you do is you step back. So again, think about those hips and shoulders facing the target, right? So utilizing this when we need to. When do we need to use it? Whenever we go to twist or rotate. Think about moving from the other body parts, this stays together. So if I'm, for example, chopping at, let's say at the countertop at home, chopping some vegetables, turn and rotate, go to grab something, instead of doing that, which just places a lot of twist on the spine and can be sensitizing for the wrong person, what you're going to do instead, chopping here, and then we just turn the whole body. Grab what I need to, come back here. Same thing, if I'm going to lift something and put it to the side, make sure we're not lifting and twisting. Instead, I'm lifting here, and then I just take a couple of steps, rotate from there. So torso control is moving the whole spine together. So another place that we want to utilize that torso control is when we're on the bed or on the floor. So I'm going to come down nice into the floor there, utilizing my split lunge, hands come back down, controlling through, and then I'm going to come onto my back, okay? So in this position, imagine I was lying on my bed, sleeping, and I want to rotate to that side. Instead of stopping and twisting like a lot of us do from that spine, think about, again, that whole torso control, or what they call the log roll. So what I'm going to do is one leg up, same arm on the same side. If I'm going to go that way, they want to be linked together. And what I'm going to do is rotate the whole body at the same time to get onto my side, okay? If I want to go back again, same thing, locking in from that position. Now if I want to go that side, I want to swap over the legs. Again, link these two together. I'm pushing off from that foot and I'm rotating all the way together, okay? Then I'm on my side, and again, if I want to come back, come all the way to you guys, rotating from there, one hand up, walking back in, pulling through, coming back up. So as we said, these three tools we want you to utilize when required. The more you do these, the more they become a habit, and the better you can move, and the quicker you can desensitize the spine.